Welcome to Better Health for a Better World, a dedicated podcast series that shines a spotlight on global health projects and programmes supported by the Government of Ireland across partner countries in the Global South. I'm your host, Nadine Ferris-France, and together we'll embark on a journey to explore the remarkable initiatives transforming lives and communities around the globe. This podcast aligns with Ireland's international policy document, A Better World, which serves as a framework for our discussions. Each episode will feature interviews with one or two speakers who are at the forefront of implementation. Get ready to be inspired by the incredible changemakers working tirelessly to build a healthier and more equitable world. Welcome to this introductory episode of Better Health for a Better World. In this special episode, we are honoured to have Minister Sean Fleming, Minister of State at the Department of Foreign Affairs with responsibility for international development and diaspora, join us. Minister Fleming will provide insights into the importance of global health initiatives and the role of Irish Aid in supporting programmes on HIV, TB, malaria, climate change, and on provision of humanitarian assistance. The Minister will speak about the critical role of education in empowering young women and girls and will reflect on his recent visit to Malawi. So, Minister, welcome. Thank you for being with us today.
Thank you to yourself, Nadine, and to Irish Global Health for facilitating me in this podcast. And it's a sign of the times to come. And I really am looking forward to participating.
Oh, well, thank you, Minister. So, maybe to get us going, I might just ask you about a little bit about Ireland's vision and commitment to global health that is outlined in A Better World. And of course, we recognise that this is a whole of government approach to international development. So we'd love if you could share a little bit about that vision and commitment with us.
Okay, first of all, I think Ireland has a very good track record in this area compared to many other countries of our size around the world. And I think overall, we're very well respected right across the world for our work in this area and generally our development work overseas. We are involved heavily in the United Nations and through EU bodies, but especially through major non-governmental organisations. And we're very fortunate to have a strong tradition of that in Ireland. So we cover most of the areas, but in particular, the emphasis for most of our work up to now has been on the continent of Africa in recent years because we operate from the simple basis we help those furthest behind first. And I think most Irish people get that and understand that. And most importantly, appreciate and support the work that we do in this area because, we're a giving nation. And I go back over the years, the Irish missionaries over the hundreds of years were abroad. There have been many of the countries that we're dealing with, and you go there and you hear about the name of father so-and-so or sister so-and-so. And even on my trip so far, I've run into some of the older missionaries who are still there, and there's a great tradition of those who were there long before us. So in a way, I actually think many of the NGOs that we're working are probably the modern incarnation of the missionaries, maybe without the religion bit attached on, because we don't have those number of clerical posts and nuns and brothers who used to do all this and they left in the past. But I think, society has changed and a lot of that work has been done by people through the NGOs now. So I think there is a traditional foundation there that we can build on, and it does help us in many of these countries. When you go to some of these places, you meet and you run into some of the work carried out by our former missionaries when they helped various work, either in the health sector or even in the education sector as well. So we do a lot of work mainly through humanitarian assistance, but healthcare services is most important in the poorest countries that we serve. If they haven't health, they're not strong enough to get into education. We want to help in the education side, but health always comes first. And we're very lucky to work in these areas. And I will say in the travel I've had so far, we do bump into USAID as well. And they're very big in the health area. And I've seen that firsthand in some of the countries I've visited in Africa. Most places you go where we're involved in, before very long you hear that USAID is heavily involved in the health area as well. So that's very important. But really, why are we doing all this? It's to continue the work for the elimination of HIV, tuberculosis and malaria. We're lucky in Ireland that we have most of these dealt with, but even HIV has not gone away and is still very much with us. And even I'm concerned to hear a little bit in recent times about an increase here at home. And so really, we want to deal with the elimination of those diseases that are with us a long time. And the prevention and the treatment of malnutrition is fundamental to all of that. And we're very lucky to be able to work with our global health partners, the World Health Organization primarily. And without organizations like that, we couldn't do it on our own or even at EU level. It's good to have a body like that that's recognized internationally, no matter where you go, and to be working with them. And in that area, it's important that we continue to fund through the Global Fund. And I think people will know we're committed to €65 million over the next 3 years. That is very substantial money. And, in the context of every day in the Dáil, when we're talking about funds for this or that or the other, I never hear people complaining about the funds we give to a project like this, because esteemed in the Irish psyche, difficult in all times can be at home and the cost of living, but they actually do know that people are much worse off than ourselves. So I think it's part of the Irish nature to be giving and to support areas like this. And that's why it's a pleasure to be in the Department of Foreign Affairs, because while you are spending money and getting taxpayers' money, it's with the goodwill of the Irish people. And that's what makes it so easy. And I think that's what makes our job very well recognised everywhere we go throughout the country. And, I think it came to mind that a lot of people, everybody knows about getting vaccines. I know when I was a kid, I got these 2 yolks on my shoulder. The marks are still there. I forget what they're for, but whatever, they're still there anyway. And that was probably our only experience really with vaccine until COVID came along. And I will say, Garvey, the Vaccine Alliance has always been in this space, but the Irish people didn't understand vaccines too much. Having to vaccinate the population or large sections of the population. So it was really good that it helped increase the awareness of the Irish people, that we're in a global world. Illnesses and diseases and pandemics can travel. They know no boundaries. They can travel with the wind. It's not just with people. And I think people know the importance of, if there's a problem in one part of the world, can easily be transmitted to another part of the world very easily. So I think it's very important. We do recognise that. And I think our work with UNAID is very important. And I think it's important for us here at home that Irish people are supportive of what we're doing. And I just say, I do want to thank the people who are involved in some of these areas. Like it goes without saying, our own health service executive, global health programme is very important, and the Royal College of Surgeons in Ireland, and of course yourselves, the Irish Global Health Network. And it helps us in our job, being able to go to the Irish people and say, we want 65 million for this project. And generally they don't ask because they know it's a good cause. So I think that's kind of setting out the big picture from what I see so far. And I'm only in the job since the beginning of the new year, but I've been amazed and impressed by everything I've seen firsthand, which I did not have the opportunity before now to see until I came into this post.
Well, Minister, we're very glad you're in this post, and thank you so much for setting the context the way you did. It's so important, these issues around global health, and the way you outlined them and link them to, even our own experience of childhood vaccines, I think is very important. I wonder, in terms of global health, it's a big field, as you know, many challenges to address, particularly as we approach 2030. What can you say about how Ireland plans to support efforts to tackle the most pressing global health challenges?
Well, I think the first thing we have to do is not forget COVID. I like to go for a day or a week or a speech or a conference without the word being COVID being mentioned, because we do like to push it behind us. And yes, we want to push it behind us, but we need to learn the lessons from COVID and learn that these things can crop up very easily and not take things for granted. So it was a wake-up call, I think, to the world population that we have to be alert to some of these diseases that are around the world and infections that can travel very easily. So I think while we've moved on from COVID, I think it's deep in our psyche now that the Irish people understand those issues. And I think most people got the message about that and the importance it is in relation to fighting these issues that are worldwide issues, such as HIV and AIDS. And it's very important that we continue to fight that. And unfortunately, 75% of new HIV infections are amongst girls. And that's disturbing from our point of view here in the Department of Foreign Affairs, because really our emphasis, whether it comes to health, or I do a lot on education projects in the countries we're working with on health issues as well. Gender equality is very important. And it's important that it's not just for the males, that the girls and young women and women in general are fully supported and not left behind as they are based on some of the cultures in the countries that we deal with. So it's important that we really keep a focus in relation to women and young girls when it comes to these issues. And that's why keeping girls in education is one of the best means. And that's the main theme of our work nearly here in Irish Aid, is education for girls, because education will improve people's ability and knowledge and standard. And it means a country will be able to make changes that might normally take 50 years in a fraction of that time if they're fully educated. And really, that's very important that we do that. And, an example of some of our great educators, and I think you'll be very familiar with Father Michael Kelly. I'm proud to say, as a Laois Offaly TD, he came from Offaly, my own constituency, and I've encountered some of his extended family. And I wasn't fully aware of him until I arrived in Zambia recently. And he was really a global health champion, particularly on gender equality and education in his fight against HIV and AIDS. And I'm very pleased when I was in Zambia with the Minister for Education, we rededicated a lecture theatre, and Irish Aid had refurbished the entire lecture theatre that he personally lectured in for so long. And he really is a hero when it comes to health promotion, especially on the continent of Africa. And during that visit, I was shown some of the books he actually wrote all over the years. I just can't understand how he had time to lecture when he was writing all these books and the work he was doing for education. And as an eye-opener, I could still be there reading some of the books, only I was moved along. And it was tremendous to work. And what people probably don't know as well, that apart from his work on the health side, he was an outstanding professor in mathematics. And that was really some of his core subjects when he was in the university. So he was very intelligent, very diverse, and it is an example of what I opened up by saying our original missionaries who were abroad. And that helped give Ireland standing in all the countries we're in today through the NGOs. And I think we do forget it. And it's important that we have standing there that was done through those organisations in the past, who sadly don't have the members to do it anymore. But as I say, the NGOs are continuing to do the work through a different guise, but it's substantially the same work when it comes to health and education promotion, and that's what we've always done, and our NGOs are continuing to do that. And also working with UN AIDS and the Frontline AIDS and the TB Alliance and Medicines for Malaria Venture. These are partners that are working on these diseases on an ongoing basis. So, we're not leading the world here, but we're contributing with all the organisations who are doing it. And for a small country with a population of 5 million, I think we're punching above our weight in these areas, but we don't claim to be able to solve the problems, but we can say we can help as best we can. So I think we can achieve more working together and share knowledge and share resources, and it's far more effective in the long term. So I think that's really important. One other point I would say is, all this is well and good, but climate change has to be brought into the debate here now, because it's something we take for granted. When I was recently in Malawi, they just come out of Cyclone Freddy, which 800,000 people were displaced. And we were helping primarily through education there. And we're working with USAID. We're very good on health issues when I was in Malawi and Zambia. And really, I do believe we can make major progress there. And I went out to a clinic in a rural area. It was really, it was an eye-opener to me. And we went it was set up by a family originally, a man who had an ambition, and he set up the clinic and he built the places and he hired some staff, and we're supporting them extensively now. And the next generation, his widow was still there. She's an elderly lady, and her family, the next generation, are involved in the running of it. But they have health professionals there and nurses there, as well as doctors on site. Only a handful. And what really shocked me was the number of people who come through that clinic. It's a remote area, And but definitely, there's 38,000 people go through that clinic, and on an annual basis, and the services it provides is phenomenal. And people actually were walking 10 miles to and from that clinic for their treatment, maybe once a month, depending on what they were doing. So that's a real example of some of what we're doing on the ground. And it was a privilege for me to see that. And on the one hand, you would say it was a depressing sight when you entered and see the lab. But I actually left, uplifted by what they were able to do with so little. And the amount of money that we were giving them was very significant, and every penny was spent about 100 times over. And that's what I thought was remarkable. So our work is a big help, but it's great to see the people on the ground taking ownership and running some of these projects. And this was a health clinic. They actually added for young girls for AIDS. They had young expectant mothers there at a clinic that day. They were teaching them how to feed their children. They're teaching them how to cook food. And because some of the girls were so young, they didn't know how to do some of this. And in some cases, maybe an aunt or a mother might have been along with them for moral support on the day. And then they had a general health clinic and in relation to HIV and AIDS and testing like that. And the great thing about that was they were able to do the work there in the little local clinic, seeing 30. And when something proved positive, they were able to be transferred to the hospital in the nearest city. It might be 50 miles away, but they were only sending those people who needed treatment to the hospital. So they were helping their own health services by, I would call it as almost a triage centre that they were doing very effectively. And what they could deal with themselves, they dealt with. And the cases that needed further medical intervention, they were able to transfer them to the hospitals. So it's really, really great work that we've actually been doing over the years in some of these countries.
Thank you, Minister, and thank you for just bringing it to bringing it alive. The clinic in Malawi, I can actually see it. You can feel that, and also just to the way you've outlined all the issues in global health that are all together in a clinic. These health needs are not separate. Issues around nutrition, issues around maternal child health, sexual reproductive health, HIV, and of course all the as you mentioned, the context of climate change. Minister, I know we're coming to the end of our time with you, and we would love and thank you. You've given us a lot of messages in what you've shared so far, but is there any message or call to action that you would like to convey to listeners? And the listeners for this podcast will be people who are very passionate about creating a better world and improving global health. And we'd love anything from you, call to action, messages from you. What would you say?
Okay, and thank you for that opportunity. And I should have mentioned as well that out of our very extensive ODA budget, which runs into well over $1 billion each year, over 20% of it is specifically dedicated to issues of health. Specifically, a lot goes on humanitarian needs and crises, and people understand that you have to have the funds. If there's an earthquake, you have to have the money at hand. And then obviously we spend quite a bit on education, but I'm delighted to see that health gets certainly at least 20% of the total spending every year. The main thing I would say to people who in relation to our work is first listen to not this podcast, the series of podcasts that are coming up. I'm not here to promote myself as a work that's actually been done. And I would say to people to keep informed, to look for opportunities to get involved and to support global health initiatives. So I'd say be involved. I actually think at home through our schools programs is very important because children get what we're talking about, because there's something inherently good about younger people. They get fairness, they know what's right, they know what's wrong, they know what's fair, they know what's unfair. When we get older, we see all the ifs and buts as to why things are the way they are with children. And I really think involvement through the schools are very important to us at every level. And I mean, starting at the primary school level, because they're more open to that and they're susceptible to that rather than just introduced it, when they're 14 or 15 in second level. And I think people will know our document. It's a Better World, Ireland's Policy for International Development. And I would ask people, if they have time, to have a look at that and pick out the bits that's of interest to you. I don't expect everyone to read every one of the pages, and it's an excellent document, but pick out the pieces that are of interest. And I would say to people involved in this area to keep saying to people you're in conversation with, the work that Irish Aid is doing, the work that we're doing on the health side, and to be aware is the first thing. And I think if people are more aware, they'll be more supportive. So I would just ask people whether it's on social media or whether it's in conversation. Conversation is better than even some of the social media platforms, because if you're in a group and there are 5 or 6 people talking, I would say, keep talking is what I would say. So that would be my final word. Keep talking about the good work we're doing and spread the message.
Well, thank you, Minister. Thank you for opening the conversation and to start us talking about what's really, really important, the work that Ireland and the Government of Ireland are doing on global health. It feels really important and such a privilege to be able to highlight some of the work in the different countries. I know we'll be speaking to the ambassadors and the NGOs on the ground in Mozambique, in Tanzania, in Zimbabwe, in Uganda, in Sierra Leone, in Zambia, and also in Malawi. So we're very grateful for you for opening this podcast and setting the tone for us all, and sharing not just from your professional portfolio, but also your personal experiences recently on your travels. So thank you very much, Minister.
Thank you, Nadine. Bye.
And that brings us to the end of this special introductory episode of Better Health for a Better World. We hope you enjoyed our exploration of the remarkable global health projects and programs supported by the Government of Ireland. Make sure you stay tuned, as we have a fantastic lineup of guests coming up in this series. Remember, by investing in the health and well-being of communities around the globe, we not only create a better world for those in need, but also foster a more interconnected and compassionate planet. We encourage you to stay engaged and to take action, as each of us has the power to make a difference. Thank you for joining us on this journey towards better health for a better world.